In this video, we'll identify how obesity affects the body's systems and organs. Obesity has become a global epidemic with devastating effects. It's important to note that the effects of obesity can vary from person to person, and not everyone who is obese will experience all of the complications we will discuss in this video. The respiratory system. Obesity causes fat deposition in the chest and the abdomen, compressing the lungs and diaphragm, inhibiting full lung expansion, and making breathing difficult. Common respiratory conditions associated with obesity include obesity hypoventilation syndrome, which is an impaired breathing and oxygen exchange, interrupted breathing during sleep, sleep apnea, and obesity-related inflammation and asthma exacerbation. The cardiovascular system. The cardiovascular system consists of the heart and the blood vessels. Fat depositions in the blood vessels lead to atherosclerosis, high blood pressure and stroke, increased heart rate and cardiac arrhythmias, coronary artery disease, and heart failure. The renal system. The kidneys filter waste materials from the blood and regulate fluid balance. Obesity-related inflammation, hypertension, and diabetes can damage the blood vessels in the kidneys, impairing their function and leading to chronic kidney disease. Excess body weight increases pressure on the bladder, resulting in stress urinary incontinence and overactive bladder. Obesity increases urinary excretion of calcium oxalate and uric acid, thereby developing kidney stones. The gastrointestinal system. Obesity is linked to an increased likelihood of developing gastrointestinal disorders. Excess belly fat causes pressure on the stomach, leading to the development of hiatal hernia and stomach acid backflow to the esophagus, causing irritation and inflammation in the esophagus, leading to the development of gastroesophageal reflux disease, GERD, and other related conditions such as Barrett's esophagus, erosive esophagitis, esophageal cancer, inflammatory bowel disease, and colorectal cancer. Studies found that obese people tend to have more cholesterol in their bile, increasing their risk of developing cholesterol gallstones. Excess fat builds up in the liver and causes non-alcoholic fatty liver disease. The musculoskeletal system. Excessive weight places increased pressure on the joints, especially the knees, hips, and ankles, leading to joint pain, osteoarthritis, and limited mobility. Obesity can also cause changes in bone-regulating hormones, bone remodeling or metabolism, and weakening of the bones, increasing the risk of fractures. The reproductive system. Obesity in women can cause hormonal imbalances disrupting their menstrual cycle, leading to polycystic ovary syndrome, PCOS, and infertility. In men, obesity is associated with reduced testosterone levels and can contribute to erectile dysfunction and infertility. The endocrine system. Obesity can cause hormonal imbalance in the body, leading to insulin resistance and an increased risk of developing type 2 diabetes. Hormonal imbalance in obesity is also associated with elevated estrogen levels in both males and females. This can affect reproductive health and the development of breast cancer in both sexes, prostate cancer in men, and ovarian and endometrial cancer in women. High estrogen levels in women can cause problems with ovulation and irregular menstrual cycle, or disruption of embryo implantation in the endometrium, leading to miscarriages and infertility. Increased estrogen level in men can also cause low sperm count. The nervous system. Obesity is linked to an increased risk of neurological conditions such as stroke, dementia, and peripheral neuropathy. Obesity increases the risk of developing mental health problems like major depressive disorder, bipolar disorder, panic disorder, and agoraphobia. Weight stigma and low self-esteem lead to depression. The immune system. Obesity can impair the immune response, leading to susceptibility to infections. Obesity is also associated with chronic low-grade inflammation that can contribute to cardiovascular disease, pancreatitis, and pancreatic cancer. According to the National Cancer Institute, obesity can cause 13 types of cancer with an increased risk of death from all causes. It is important to maintain a healthy weight through a balanced diet and regular physical activity for overall quality health and well-being.